Assalamualaikum everyone. How are you all? Welcome to another episode of The Pathfinder, and I'm your host Farheen Lodhi. Today we will discuss a very sensitive topic, humanity beyond the borders. As today we are looking past the lines drawn on the map and walls built between culture. From shared struggle to unexpected connection, this is humanity beyond the borders. Exploring what happened, we look at the world not through the division but through our shared human experience. Welcome to the show. So, we are honored to have Dr. Wissam Doudar with us today. I have the privilege of introducing our distinguished guest. Thank you so much, sir, for joining me. Assalamu alaikum, and how are you?
Thank you, Farheen. It's very honor for me to join you on this day, on this occasion, and on this title. I hope that our audiences and those who are watching us will enjoy and will get some good information about the topic.
You are the health expert who focuses on refugees program, UN consulting, and human rights as well. Sir, can you please tell me about your journey?
Okay.
For me and my audience.
Actually, I'm the board member of the Global Goodwill Ambassadors and also the global and the board member of the Federation of International Gender and Human Rights. Before that, like 2 years ago, I resigned from United Nations after 35 years of being a public health expert dealing with refugees and those who are displaced, especially under emergency circumstances and situations over all Lebanon and Syria, and some research was made on Jordan. I have this vast experience. I'm very lucky to have this experience or exposure to public health in the region and also to humanitarian principles at a global level. And also I'm specialized in human rights and gender-based violence with doctorate degree from Harvard Heritage University. My master's public health was from the American University of Beirut. And I'm enjoying and happy to have all of these that I have accomplished until today in order to convey the expertise to those who are willing or thirst to know about the issues that I'm keen at. Thank you again, Farheen. I would like if you can tell me something and our audiences something about your good self and about the activities you are running and doing.
Thank you so much, sir. It's a really remarkable and impressive for overall. Let me start our conversation. May I ask, sir, in a world increasing divided by borders, politics, and conflict, how can humanitarian organization uphold the principle that every human life has equal value, regardless of nationality, authenticity, religion, and legal status?
Actually, this is a very complex question and very smart one. Thank you for asking this question. All of those who are vulnerable and affected by different situations and harsh situations especially are affected directly in your question, actually. In a world fractured by wars, political polarization, rising nationalism, and unprecedented levels of forced displacement, humanitarian community faces a defining moral challenges. Like, can humanity remain greater than borders? This is a very good question. Every day, millions of people, as we know, are denied the protection, healthcare, education, and dignity, not because of their needs, but because of their nationality, ethnicity, religion background, and legal status. Yet the very foundation of humanitarian action is built upon a timeless principle that every human being, every life has equal value and deserves equal protection. And this is the cornerstone. To uphold this principle, humanitarian organizations must remain firmly anchored in the universally recognized humanitarian principles of humanity, impartiality, neutrality, and independence. Assistance should always be provided solely according to need, never influenced by politics or race, religion, or immigration status. Human suffering knows no passport, and compassion should recognize no border. However, principles alone yes, are insufficient. Principles alone are insufficient without courageous leadership. Humanitarian organizations must become stronger advocates for the rights and dignity of those who have no voice or left behind. They should challenge discriminatory policies, promote inclusive humanitarian access, and remind governments and societies that protecting vulnerable people is not merely an act of charity. It is a legal obligation under international humanitarian and human rights law, and moral responsibility shared by all humanity. Partnerships are equally essential. Local communities, faith based organizations, civil society, governments, academia, and the private sector as well, each possesses unique strengths. When they work together, they can create responses that are culturally appropriate, sustainable, and centered on the people they serve rather than on institutional agendas. Those affected by crisis should not be viewed merely as beneficiaries, but are partners whose resilience, knowledge, and leadership are vital to successful humanitarian actions. Technology also offers unprecedented opportunities to transcend borders. Digital health, for example, artificial intelligence, remote learning, cash assistance, and real time data systems can extend life saving services to populations previously beyond reach. Yet, innovation must always remain ethical, inclusive, and focused on protecting human dignity rather than increasing inequalities. Above all, humanitarian organizations, as you mentioned, must never allow compassion to become selective. A refugee child feeling conflict, fleeing the conflict, and the migrant standards at borders, families displaced by climate disorders, disasters, and civilians trapped in war all share the same inherent human worth. Their lives cannot be measured by geography, politics, or legal definitions. Actually, they are human beings and deserve every interest and every care. The future of humanitarian action depends not only on building higher walls, as happened before in the World War II and One, but on building stronger bridges of solidarity, justice, and shared responsibility. Humanity reaches its highest expression when it refuses to ask where someone comes from before deciding whether they deserve help or not. We should know that humanity beyond borders is not an aspiration, it is an obligation. When we recognize the equal value of every human life, we do more than save lives. We preserve the very values that define our common humanity. This is actually, I hope it answered your question.
No doubt, no doubt. After your answer, it's so elaborate and in detail. I must remember one sentence about Abdul Sattar Eidi. He's the biggest humanitarian in Pakistan. He said, "No religion is higher than humanity." I think so. You clear it in your answer.
Yes, it is evident that yes, religion will support and encourage doing good for people, but we should care for people irrespective of their religious background or belonging, race, sect, nationality, color, whatever. No discrimination at all whenever it comes to humanitarian interventions. Also, we should not focus on sex, on gender, or gender nationality. All those who deserve our support, they should receive the support. Equality
No doubt.
should be there all the time.
All the guys. I'm sure we will learn all the things. Sir, how can humanitarian intervention move beyond providing emergency relief to creating sustainable resilience, dignity, and self-reliance for displaced population and vulnerable communication?
Actually, it happened before in the passing decades, previous decades. Humanitarian organizations used to distribute ration and food supplements and non-food supplements for those who are affected. And this will make them depending on the NGOs or the humanitarian communities or NGOs to provide the support. Uh, Better than this, we should support the families affected by any emergency, but at the same time, we have to make them empowered to bring their breads by themselves. No need to make them rely on NGOs just to take their food or life substances and needs. Humanitarian assistance has traditionally focused on saving lives during emergencies, and rightly so. Yet, today's crises are increasingly protracted, driven by conflict, climate change, economic instability, and forced displacement. Millions of people now spend years, even decades, in humanitarian settings. In this reality, providing food, shelter, and medical care alone is no longer enough. The true measure of humanitarian success is not only how many lives we save, but how many lives we help rebuild. Rebuilding the communities starts with rebuilding the individuals. Moving beyond emergency relief begins with a shift from depending to empowerment. Humanitarian interventions should be designed from the outset to strengthen people's capacities, restore dignity, and enable self-reliance. They should rely on themselves. This means investing in education, vocational training, livelihood opportunities, healthcare, digital skills, and access to financial services, allowing displaced individuals and vulnerable communities to become active contributors to their own futures rather than passive recipient of aid. To receive aid temporarily is good, but it's not good to go on like this for long. Equally important is placing affected communities at the center of decision making. Sustainable solutions cannot be designed for people, they must be designed with people. Listening to community voices, respecting local knowledge, and supporting community-led initiatives create interventions that are more effective, culturally appropriate, and sustainable. Human dignity flourishes when people have ownership over the decisions that shape their life. Also, we should always listen to the voice of those who are in need. Building resilience also requires a stronger collaboration across humanitarian development and peace-building sectors. Emergency response should seamlessly transition into long-term investments in infrastructure, education, public health, social protection, environmental sustainability, and local economic development as governments, local organizations, the private sector, donors, and international agencies must work together under a shared vision that addresses both immediate needs and the root causes of vulnerability. Usually, we ask 5 questions, each one starts with why. In order to reach the root cause analysis, we should ask why 5 times in order to reach the root cause for any vulnerability or any suffering. Innovation further accelerates the transformation. Digital cash assistance, telemedicine, online education, artificial intelligence, climate smart agriculture, and renewable energy solutions can expand opportunities while reducing long-term dependency. However, technology must always remain inclusive, ethical, and accessible to those who need it most. Ultimately, resilience is about more than surviving adversity. It's about restoring hope, opportunity, and the freedom to shape one's own future. Every displaced person, refugee, or vulnerable individual possesses talents, aspiration, and potentials to contribute to society when given the opportunity. But we have to give them this opportunity to express themselves. Humanitarian action must therefore evolve from delivering aid to enabling lives. This is very important. By investing in resilience, protecting dignity, and fostering self-reliance, we transform humanitarian responses from a temporary safety net into a pathway toward lasting recovery, sustainable development, and shared prosperity. That is the true meaning of humanity beyond the borders.
Thank you so much. I'm sure these tips it must be helpful for everyone who take the actions
Yes.
for the humanitarian for the humanity.
There should be a transition or transforming in the providing the aid and support for those who are affected, from giving them the aid and support and supplies and food supplements to empowering people, to make people express by themselves. How will they shape their
Hmm.
future? What are their needs? We have to listen to the voice of those vulnerable individuals, without which we can't tailor. Anyway, if we will exert the pressure and efforts to tailor solutions for them, we won't reach the perspectives they are looking for. We have to listen for them.
Exactly. Exactly. The people are homeless, hopeless, foodless. We should help them. Sir, thank you so much for share your words, share your thoughts about the humanity. Thank you so much.
It seems
As
your questions
technology
are very selective and sensitive, and your questions
as
entail
you share with
most
me,
of all those vulnerable and in need for
I
support over all the globe.
that will the entire world one day have adequate health care?
Okay. Actually, as you know, human rights calls for different principles. One of them, health for all. No one diseased or ill person should be left without provision of medical care services that any person in need for it should receive the optimal care, optimal medicines, proper treatment, diagnostic services, admission to hospitals, receiving medical consultations. All of those are the rights of every individual on this globe. Unfortunately, most of those living in the third world or developing countries are still paying out of pocket to receive medical care services, and they should pay for medical insurance companies in order to be covered. Whereas
Biggest truth.
WHO and the international law states that health is for all. How it is for all if most of the people should pay out of pocket? How to explain or how to translate this slogan health for all at several countries where millions of people are affected. I believe the world can achieve universal access to adequate health care, but only if health is recognized as a fundamental human right rather than a privilege. Health is never a privilege. While remarkable advances in medicine, technology, and public health have improved millions of lives, vast inequalities persist. Too many people still lack access to essential health services because of poverty, conflict, displacement geographically, or political instability, and lack of access to the place where healthcare is provided. Achieving equality or equitable healthcare requires more than building hospitals or clinics. It depends sustainable. It demands sustainable investment in strong primary healthcare systems because primary healthcare is the gatekeeper for hospitalization. Whenever anyone will feel ill, this person should receive or consult the physician at the primary health care, who will decide if this person will receive medicine or do some medical examinations and go home or should be referred immediately to the hospital. So primary health care, if we have integrated primary health care system, this will minimize the hospital admissions and will lower the cost for or the bill, the national bill for health, as well as trained health workforce. if we have medical doctors or medical staff who are not well educated or well trained, we will suffer and the community will suffer. Also, digital health solutions should be available, disease prevention, and resilient supply chains. It also requires that international solidarity, where governments, humanitarian organizations, donors, academia, and the private sector work together to strengthen health systems rather than respond only during a crisis. Some communities are happy that a crisis happened, so they will have plenty of NGOs interfering in their areas and providing services, especially mobile medical units and providing some essential drugs. But actually, I'm sorry to say that it should not be the case. The provision of healthcare system and accessibility to primary healthcare should be always available at any country, at any village, at any city, at accessible distance from any patient. Healthcare challenges such as pandemics, climate change, and forced migration do not respect borders. Our response should not be limited to them by their should not be limited to those people, but only to every individual who will be in need for healthcare. When we commit to equality, innovation, and shared responsibility, universal healthcare becomes not an impossible dream, but an achievable goal. A healthier world is ultimately a safer one, more stable and more prosperous world for everyone. And health for all should remain all the time the slogan and should be enforced and implemented everywhere on this globe. And every individual without any discrimination should receive the optimal care, health care, anywhere this person will be available. Some people are applying for loans in order to do some surgeries or open heart surgeries, or they are borrowing money from relatives or from community or from charitable organizations, asking them to collect some money for them in order to be operated for life-saving operations. And this is shame on us. We are living in the 21st century, and we still have high prevalence of poverty and people who are left behind and people who are suffering from crisis and from emergencies and from armed conflicts and from climate changes, and they are left without any support. This is a very, very big shame on humanity to keep those people behind or without any support.
It's really fruitful conversation. I really enjoyed. Thank you so much for having me.
If you will say one word here, maybe some people watching us will be surprised or astonishing. Actually, wudu is one of the basics of public health and self hygiene. Yes, it is required for Islam before praying to be practicing wudu, and maybe some people know about it, some people don't know about it. But wudu is a good principle in Islam to keep the person clean and keep good hygiene of every person who is going for prayer.
Yes, no doubt. I noticed it. What was humanity beyond borders mean you, and what is the single greatest barrier prevented for us for achieving it?
Yes, this is also a sensitive question and needs a lot of thinking. But briefly, I can say, for me, myself, humanity beyond borders means recognizing that our shared humanity is stronger than the political, cultural, religious, and geographical boundaries that divide us into different countries. It means valuing every human life equally and responding to suffering with compassion, justice, and dignity, regardless of who a person is or where they come from, irrespective of their background, their nationality, religious background, color, sex, whatever. Humanity is humanity, and all should be treated with dignity and equally. The single greater or greatest barrier to achieving this vision is the absence of collective political will. Whenever you are planning to have this in place, you will be stuck with some political views who can interrupt your boat, interrupt your journey, and try to divert it in a different way. And actually, some political stress is being exerted on not having this in place. So, we possess the knowledge, resources, technology, and expertise to reduce suffering on a global scale. What is often missing is the commitment to place humanity above political interests, fear, and division. When national agendas outweigh universal human values, vulnerable people are too often left behind. Humanity transcends borders when we replace indifference with solidarity, competition with cooperation, and exclusion with inclusion. Our greatest achievement will not be measured by the borders we defend, but by the lives we protect and the dignity we preserve. That is the essence of a true humanitarian leadership. And I hope all efforts and all political forces and all governments will agree and put hand in hand in order to make this happen, because this is good for the humanity at large, not for humanity at very local place. It is for the humanity at large. And I hope and we pray that they will reach an agreement, at least, to have the humanity and the provision of solidarity and supporting all those humanitarian principles. I hope they will agree and put hand in hand to support the humanitarian principles, irrespective of any discrimination, away from any discrimination. But only political forces sometimes opposes the plans that are being made to reach this nice end. That is the way.
Thank you so much. I hope so. These all tips and things will implement for the support humanity, inshallah.
Inshallah.
Inshallah. Thank you for being a guest on the podcast. I really enjoyed our conversation. Thank you, Sir Wissam. Thank you.
Thank you, Farheen, very much, and thank you for the very smart questions regarding the topic. Actually, they are hot questions and affecting almost all individuals on the globe, and all of those who are vulnerable or affected by crisis, by displacement, by wars, by climate change, by disasters, natural and handmade disasters. Almost people, maybe more half of the people of the globe are affected by whatever you discussed today, and the questions that you selected are meaning very well to most of those individuals. Thank you very much, and have a nice day. Thank you.
Thank you. I hope so. Okay, I will connect with you another episode, another topic. Thank you. Bye bye.
I
Allah
hope so.
Hafiz.
Thank you very much. Have a nice day. Bye.
Have a nice day too. Allah Hafiz.